Today's episode is for anyone living with back pain and tired of treatments that only work temporarily. I'm joined by Dr. Hazel Jenkins from Macquarie University in Sydney, the lead author of one of the largest studies on long-term treatments for chronic low back pain. Most treatments only help in the short term, but this study looked at what still works 1 to 2 years later. And the findings might completely change how you think about healing. Dr. Jenkins, thank you so much for accepting my invitation to the show. I am so excited to have you here.
Thank you so much for having me.
I would like to start with a question every listener with back pain quietly wonders. Why do the improvements never seem to last? Why do people feel better for a while and then find themselves in pain again?
Yeah, it's a really good question. So we know that back pain is a really complex condition now. Many years ago, it was thought that back pain was largely driven by physical factors, so things like a problem with your muscles or your joints in your back, and that once that tissue injury healed, then your pain would go away and you wouldn't be bothered by it anymore. But we now know that it's a lot more complex than that. And while there may be some physical factors that are involved in your back pain, particularly initially, there are a lot of other factors that can also get involved in how pain is actually processed in your body and how it's felt. And so these can be things like psychological factors, like your beliefs and your behaviors, your mood, and they can be other social factors, things like how much social involvement you have, how much sleep you get. There are many different things that can actually impact how we feel pain. So we now know that back pain, and particularly chronic back pain, which is when pain starts to last for 3 or more months, becomes this more ongoing fluctuating condition, very similar to other chronic conditions such as high blood pressure. It's something that will go up and down over time, but there may always be some element of it. And so we find that a lot of treatments will tend to target those more physical factors and can help decrease some of that pain, but they don't necessarily target all the factors that are contributing to the back pain, and so it still tends to come and go over time.
It's very interesting you said our mood and psychological factors. I was experiencing chronic low back pain, and we actually lived in Australia at the time. And living away from my family because I'm from Hungary. And I was just diagnosed with Hashimoto's thyroiditis, underactive thyroid. And I kind of felt isolated because we just moved there. I had no friends. And I was dealing with chronic back pain. That was the worst time of my life. I could not get out of bed. I could barely walk. I couldn't go to the gym, and I enjoyed moving always. And it was very depressing. And I was in my early 20s. I thought back pain only affects people, who are older, but I was in my early 20s.
Yeah, and that's exactly the story we hear from a lot of people. And back pain can absolutely affect anybody at any stage of life. We see it's actually quite common in adolescence, and people who have it when they're younger in adolescence will be more likely to have it as they get older as well. And yeah, the impact between, or the interaction between pain and mood and activity, and then what you can do in your social life, it's all so interrelated together. It can be hard to tease apart what starts it or what comes first. But in a lot of cases, it probably doesn't matter which initially started it. We need to break the cycle in a few different places. And so that can be using strategies to try and decrease the amount of pain you feel, which are often some of our more, traditional hands-on kind of strategies or exercise. But we also need to think about those other components and how do we potentially address the psychological changes, the mood changes that are happening at the same time. How do we get you back to your normal activities, which makes such a difference. If, we can manage a lot more if we can get back to what we enjoy. You can have, you can really have the same sort of pain level, but if you're doing things you enjoy, you don't notice it as much as if you're not able to do those things. So these can make a really big difference, and they're all things we should think about when we're trying to work out how best to help someone manage their pain.
For some reason, when you are happy or when you go out and when you enjoy something, suddenly your back pain isn't as bad. I realized that, my back pain is okay. I'm not saying it completely went away, but I feel good. Yeah. I personally experienced that.
Yeah, absolutely. Whether that's because you're distracted and you're thinking of other things, or because the positive experiences you're having, they'll release things like endorphins in your body, which we know help to decrease pain levels as well. So there's lots of things that could be happening there.
Exactly. And for some reason, I mean, personally, I'm talking about my back pain now. I had a very bad phase for a couple of years, and now I feel good. There are time to time I do feel my back, especially when my husband travels. He's out of town, and I have to do everything by myself around the house. And I do know that when that happens, I need to take a step back and I do a little bit less. I make sure I sleep enough because we also have a kid. And I have to look after him as well. And I need to be good. So I don't push myself for that extra. I make sure that I'm not pushing myself and I can manage everything. But time to time, if I do too much, I still feel my back. But now I know what to do.
Yeah, and that's the important thing. You now know what it is that you need to do to help you manage that back pain. And so it's really important to have those strategies and to be able to think, yes, this is a time when I just need to take a little bit more care of myself. But then know that that's not going to last forever and you can get back to all your normal things at times when you have a little less stress and a bit more support around you. Just being able to recognize as well that the pain does go up and down and it does
Mm.
relate to other things that are going on. I think that's really powerful. So that you know that you have some level of control over it. You can change things to help with that pain. Whereas if it's just ongoing pain and you don't know what's triggering it or adding
Mm.
to it, that can be very disempowering. And I think that's when people really get quite despondent about it and really think it's never going to change because they don't recognize what's actually affecting that pain.
So, Dr. Jenkins, your paper analyzed 75 trials over 15,000 people, right?
Yes, that's correct. Yeah.
That's huge. So, when you looked at all those results, 1 to 2 years later, what genuinely made a difference?
Yes. Yeah. Well, what did actually surprise us is that there were lots of treatments that had small effects, which did actually quite surprise us. So a number of the treatments that were being tested were ones that we thought would probably more target short-term effects. So things, for instance, like manipulation. We know that manipulation is designed to try and get the joints moving more freely, help to release the muscles, which are more of those physical components. So more we thought would be related to more short-term effects. But even those sorts of treatments also tended to have these longer term effects as well. And we think possibly that could just be, by breaking the pain initially, it helps people get back to their sort of normal activities and can still have a positive effect. But when we started to see more moderate effects or larger effects in the difference at 1 to 2 years, it did seem to be when we had a combination of treatments. So either treatments that were addressing the more psychological components with pain, so things like cognitive behavioral therapy and mindfulness, which will help address some of the beliefs and behaviors related to pain, or treatments that combined that more psychological component with a more physical component, usually exercise. And so they'd have some components that were helping to address beliefs and behaviors and other exercise treatments to, one, get you back moving, but also to help with any physical components there as well. And just that addition of a few different components, which we think then is potentially targeting multiple contributors to your pain, seem to give those larger effects at 1 year, which is really encouraging.
Okay, so physical activity had a long-term positive effect, right?
Yes,
Combined with cognitive behavioral therapy, right?
yes, yeah. So both of
Okay.
those, both separately and combined, seem to have some
Oh,
good
okay.
effects.
So separately and combined. Wonderful. So physical activity alone can long term can definitely help you recover or feel better with chronic low back pain.
Yeah, that's right. I mean, we've known for a long time that exercise is one of the best things for low back pain, particularly chronic low back pain. Um, and that's been based on mainly short term, so usually up to about 3 month results. So what was great about this study is that we did show that there were also positive benefits at that 1 year plus mark as well. And even we've got new work that's just come out of Macquarie University with one of my co-authors, Mark Hancock. And he's shown as well that even a simple exercise like walking can be really effective at preventing future back pain as well. So we're getting multiple evidence for exercise across short-term, long-term, and also prevention domains.
That's wonderful to hear that, and I need to invite him to the next episode as well.
Yeah.
I'm excited. Okay, that's really good news. That's really good news because I created this Pilates in pajamas program. I go to on YouTube every single day for 10 minutes for people with chronic low back pain. And we do very simple Pilates movements for back pain, for back health. And I was wondering if it is helpful or not. And, I have different researchers, and everyone is assuring that physical activity is one of the best things you can do for chronic low back pain, something that feels good for you. I mean, everyone is different. If someone is not into Pilates, they would probably not enjoy it. So it has to be something that they enjoy. Maybe they prefer walking.
Yep.
So, but that's wonderful news. So thank you so much.
And that's a really important thing. And so, yeah, we know overall that exercise is helpful. There have been studies that have looked at the different types of exercise. And to be honest, there's no one exercise that looks like it's substantially better than in the others. And I think as well that it is very much what you enjoy to do. So getting moving, particularly if you can do it in a more of a social environment as well, if that's possible, but just something that you enjoy doing and will happily do would be more important than doing an exercise that you don't like. Like for me personally, I don't like yoga. And, it's often touted as one that's really beneficial for people. I know when I was pregnant, everyone was telling me I needed to do yoga, but it's not something I enjoy. So I don't find it helpful, but other forms of exercise that I enjoy doing, I find very beneficial.
I feel the same way about yoga. My best friend in Australia, she was a yoga instructor. I always admired how flexible she is, but yoga is not for me. Pilates was always my type. You don't have to be flexible. It's a good movement, and it helped me to recover from chronic back pain as well. But yoga is not my thing. I'm a part of a mom's group on Facebook, and a mom recently posted a very interesting a post. She said, I just need someone to fix my back. I don't want a physical therapist. I want a chiropractor to adjust me and fix my back pain. And it really hit me because I think so many people feel that way when they are in pain. Of course, they just want to be fixed. They want the pain to go away, right? And they would do anything. And it made me wonder, with that someone fix me mindset, can people really get better long term? Or does recovery require different kind of involvement from the person in pain?
Yeah, that's a really good question. So as I said, back pain's quite complex. We get lots of different types of back pain as well. So there are some people who get what we call acute back pain, where you get this short episode of back pain, and for them, they can get that back pain episode resolving, and they might not get another one again. And so you can get a very short-term effects, and in that sort of case, then having someone fix their pain might seem like it's been very helpful, because it was probably going to reduce anyway, to be honest, but it's the treatment does help just get them out of that initial pain. And we do know that a number of these treatments can be really helpful in that short term space as well. So things like manipulation that will be performed by a chiropractor can be very helpful just to help decrease those initial aspects of pain. If it resolves like that, great. If you do start to get pain that either doesn't resolve as quickly, or it starts, you get more episodes of pain, that's where going for those sort of quick fixes is unlikely to be helpful in the long term, or at least you'll have to depend on your practitioner. Now, there's nothing wrong with that if you're happy with that, but it does mean that you just won't have strategies to help the pain yourself as much. So that's what we do want to try and encourage more so, is that people know what drives their own pain and what they can do to manage it without having to rely on a practitioner all the time. And there are mixes of those as well. So my clinical background is actually as a chiropractor. I've got patients who come in and we just need to get them out of that initial pain enough so we can get them back moving. And so we do, manual therapy, etc., or other forms of treatment, exercises, etc., just to reduce that initial pain, but then starting to give them the advice and education they need to understand what's driving their pain, what they need to do themselves, and how they can continue to be pain-free. Now, often that does include doing, some regular exercises or looking after a few things like that. And some people aren't interested in that as well. So I'll have people who tell me, yeah, I understand that would be really good for me, but I don't actually want to do that.
Yeah.
I'd much rather come and see you every so often if I need to. It's like, well, that's your choice at the end of the day. Yeah.
Yeah, I do have patients and clients like that too, that they don't want to do the exercises. Someone else can do for them, but they don't want to do the exercises, unfortunately. But at the end of the day, I think to be able to do your daily tasks, you have to, because you get better at things you actually practice. So, for instance, getting in and out of the car, you need to be able to do some squats. I do find that many people with back pain have a hard time getting in and out of the car or in and out of the chair, right? Because their back hurts, right? So we need to slowly, gradually practice that movement. So their nervous system is okay with that as well, that this movement is okay to do.
Yes, and that's a really important point. So, what often happens with pain is when the pain happens with a certain movement, like getting in and out of a car or out of a chair. A common one is bending forward. That's
Exactly.
what hurts a lot when you first have your pain. You start to avoid that movement because that's what triggered your pain, which makes a lot of sense. But we can't be afraid of that in the long term. Otherwise, it does actually create more problems. And so, yes, exactly as you said, we need to get back into, once we've made sure that there's no issue there, when you first have pain, there may be a really good reason why you're not bending. So your most typical one might be that there could be some issues happening with, say, one of your discs in your back. Initial bending when there's a problem there will make it more painful, and we don't want to do that at that point in time. But a month later, 2-3 months later, that initial problem isn't there anymore, and we need to get back into that normal movement. And that's often when people keep guarding and keep avoiding it.
Exactly.
That can become more problematic. So yes, as you say, we can then teach them, okay, let's just practice this movement in little steps, show you that it's safe, get you doing it regularly so your body knows it's safe, and we'll just do it more naturally. And that can be really important for recovery.
I remember my son was born, and there was a lot of crying in the beginning, like little baby, right? And then in the middle of the night, I had to stand, bending over the crib and soothe him. And my back was killing me the first couple of weeks. After a while, I've got used to it, but I remember standing there and, oh my God, my back is killing me. And I find that especially when you're a new mom, you just had a baby and you're not used to carrying couple of pounds all the time, right? Breastfeeding in different positions for 45 minutes to an hour. And I think it's also very important, especially for moms, to be prepared when you have a child, because it's my experience that it was definitely a new experience and it wasn't easy on my body. Even though I was a Pilates instructor, I didn't practice those movements. I was really good at Pilates repertoire, but I wasn't good at, daily tasks, how to take the baby out of the crib, or, that weight. And your body needs to get used to those movements. You need to teach and you need to practice those movements.
Yes, look, it is a good point. And it's tricky. I've had exactly the same situation. I can remember also bending over the cot and trying to pat the baby to sleep, and my back just absolutely killing me. But it's also a thing that I wasn't enjoying doing. I found it quite stressful trying to get baby to sleep in that fashion.
Good point. Yes.
And so, yeah, the pain does come on very quickly because there's other things that are triggering it as well. It's not just the position that I'm holding, because to be honest, I hadn't actually been there that long. it probably wasn't anything to do with the position. It was just that I was there going, okay, just go to sleep already. And
Sleepless nights for you as well,
yep,
right?
exactly. So I think some of it's just being a bit kind on yourself as well, recognizing that there will be some different things, trying to set things up when you can. A lot of cots now, they raise up so that you don't have to bend as much, making sure when you do have to sit for a while that you're sitting in a comfortable position where it won't be too bad for you. But I think, just recognizing as well that it's not, I think it's important to know that that activity is not causing your pain or creating damage in your back. There's lots of other things that are happening at that time that are meaning that you're feeling pain. And if you can, try and move and change that position if you can.
It's
If you can't, because you have to pat the baby to sleep, then just know that when you do get to move, it will be okay and it's not causing a long-term issue.
That's good. Thank you. Thank you for explaining that wonderfully. Now, something on the research paper really stood out to me, that cognitive behavioral therapy and mindfulness actually hold up for years. And that's why, because most people see that back pain is a mechanical problem, discs, posture, core strength. Why do you think those mindset approaches are so powerful?
Yeah, and I think they can be particularly powerful for these people with more chronic pain and to help with these longer term outcomes, because they are designed to really try and address all those different beliefs and behaviors that we might have around back pain that just aren't very helpful. And so things like cognitive behavioral therapy and mindfulness teach you different strategies to be able to help with some of the fears and worries that you might have around back pain. So mindfulness particularly helps you think about, it's sort of a form of meditation. It's going to help decrease stress that you have as well, but also gets you thinking about different areas of your body and how they're feeling, and really making you sort of concentrate on certain areas to sort of show you that that they're still healthy and safe, and that different movements will create different feelings, and that's okay. And that's a really important message to have. If I bend backwards far enough, it will hurt. And that's okay, because it should do, because I'm taking tissues to the end of where they should be stretched to.
It's
And so there will be
protection.
some pain. It is protection, and it's also normal. And so some of these techniques help to tap into how your brain's processing the pain and sort of reset what you think is normal or harmful. So pain is a warning to your body. It is a protective thing. It's there for a very good reason. You touch something that's really burning hot, you want that pain response to make you take your hand away very quickly so you don't get burnt, for example. But unfortunately, sometimes our body sort of overdoes it a little bit. And so it tells us things are painful, or we process them as being particularly painful when there isn't actually a direct harm there at that point in time. And so, cognitive behavioral therapy and mindfulness are different strategies that can help teach you tools to sort of reset that understand how the pain is actually impacting you or not impacting you, and that different pain can be or different sensations rather, can be quite normal. And that can really help the back pain in the long term.
So going back to pain is like a smoke alarm, right? It can go off even if there is no fire.
Exactly. Yep.
Because it's just too sensitive. Like you make a burnt toast, there is a burnt toast and the alarm goes off because it signals there can be a danger, but there is no danger.
Yes.
Because we are sensitized, right?
Yeah, no, that is correct. And lots of different things go into it. So in the actual sensation that we feel of pain has lots of different components to it. So there's a component where you might be getting receptors, which are called nociceptors, stimulated in the body. That's sort of what we traditionally think of as pain. Some people call them pain receptors, but that's really not a very correct term for them because it's just literally something that's stimulating. So if you overstretch a muscle, it will stimulate your nociceptors, for example. That information is taken up to the brain, and that's when it's processed to give us the sensation of pain or not pain. But at that processing point, lots of other things come into play. And that's where things like how much sleep you've had, how much stress you're under, what else is going on with you, what your beliefs and behaviors are around that pain. They can all impact on how that pain's processed in the brain, but also what you interpret from it. So two different people could potentially be feeling the same sort of sensation of pain, but interpret it very differently. Some might interpret it as, oh, that's fairly normal. Yep, that'll be fine soon. And others might interpret it as, oh, no, that's a real problem. That's going to be something that's creating damage. And then what we end up doing after that becomes quite different. And that can impact how pain continues to affect you.
Very, very interesting. So we both can have the same pain and we interpret it in a different way, right? If I do a split, I can do a split and you do a split, your body would probably send you signals that, oh my God, this is not okay to do.
Definitely. I cannot do the splits.
Is it because my brain got used to that kind of sort of pain?
I don't think it's not necessarily that it's got used to that sort of pain. If anything, the longer we've had pain, the more sensitive we actually tend to get to it. It's more how you interpret it. So some people will interpret it as a fairly normal thing. So, okay, I've got some pain. That means that maybe I've stretched a little bit too hard there. I'll just back off on that a bit and then just go on to what else I'm doing. Whereas other people might go, oh, hang on, that's pain, that's hurting. I must have torn something. I must have overstretched something. That's going to be a problem. I better pull back. I better stop doing my normal activities. I better protect that area. And then that just sort of has a flow-on effect from there potentially. I don't think I mean, there is probably an element of getting used to things as well to some extent if you've been living with it for a long time. But I mean, we know that people with like very severe chronic pain who come to us for help, they haven't got used to it. It's still really impactful and really affecting them. And so these are people where we just need to identify what contributors are really important for them and how we can best address those. And it can be very complicated to do that.
You said something very interesting when people think that they did something and there is a damage, they torn something. I had a client, we worked on her back pain and we tried to address the sleep and, definitely she needed to do some lifestyle changes because it definitely affected her back pain. And she constantly was saying that she feels that her back is out and someone needs to put it back. So we did an exercise and she was like, no, I feel like my back is out and someone needs to put it back. And can our back be out of alignment?
Not really at all. But I understand people who feel that that's what's happening there. So as I said, as a chiropractor in background, that's something that we often get. People will come to us and say, "Oh, my back's just out. Can you just crack it? Can you just put it back in again?" But that's not what we're doing. So the spine is made up of lots of different vertebrae, lots of different joints there, and those vertebrae they stack up on top of each other. We can get curves in the spine, which is fine. And that can, that's quite normal that people have different curves and different postures. But the joints themselves don't go out. Okay, if by going out, that would sort of mean it's like dislocated or partially dislocated. That's not what happens to the joints. They may stop moving as well as they should do. So they may become a bit restricted in their movement. That's usually what people are feeling. So what they're feeling is that when they're moving, things aren't moving as smoothly as they normally would be. And that's usually what people mean when they feel like it's gone out. Either that or they're actually feeling some muscle tension around the area. And again, it just makes it feel not normal. So not normal movement, not smooth movement. And that's usually what they're referring to. And in those cases, then some sort of manual therapy or some sort of other help to help relax the muscles or get the joints moving better can be helpful for them in the short term. It's not something that's essential. So it's not like if you don't get that treatment done, you'll never get better. There are other ways to manage it as well. If you just keep exercising through it, it would also improve as well. But there, as I said, there are lots of different strategies, and different things will help different people at different times. The one thing to be very careful of is anybody who does say, yes, that your back is out, and if we do this, we'll put it back in and then everything will be fine. That's unlikely to be the case.
I've been helping women with back pain for years, and unfortunately, I had quite a few that they, after a month or two, they just give up. They just gave up that this is not going to work. Nothing is working. Only surgery will help them. You know the solution. You really want to help those people, and they still believe that their back is out and someone needs to put it back. They need to have certain surgeries. Unfortunately, even if you tell them the evidence, you get better with these strategies. It might take time. And unfortunately, do you see that as well in your practice?
Yeah, definitely. And look, these can be some of the unhelpful beliefs that, if you do really strongly believe that there is a structural cause to your pain, and that something is out, or something is torn or damaged, and that's why you're getting pain, that can be a really difficult belief to change. And it can be one that's quite unhelpful, and can drive future pain. And we certainly try different things where, in terms of education of the patients, try different treatment techniques to see if we can get them. We really just trying to tap into trying to get them to understand that sort of normal movement that will potentially stress and strain different tissues, but that's okay. And so, yeah, we often will just be trying lots of different strategies. We do have a number of different programs as well that potentially can be helpful. So, for instance, we've started running in Australia what's known as the Glad Back program, which was developed in Denmark. And this is a program, it includes group exercise and education classes. It's really designed for people with chronic or recurrent back pain to try and help them develop these self-management strategies that we think are important. So for some people, we find that those group classes can be really useful because they're learning with others. The exercise classes are really integrated with the education to do them. It's not so much about you have to do this exercise this number of times, but we're actually just taking them through lots of exercises to show them that they're safe and they can do things and that they can do through this without any problems. So that can be really helpful for some people with those sorts of more structural beliefs. Other times you might need more of a targeted individualized program. So things like cognitive functional therapy is a similar type of program, which again really tries to look at the different contributors to that individual's back pain and how they can be addressed through different means. And so, yeah, we have a number of different programs where we try to address all of those components, but it can be very, very challenging. And, we're often brought up that way, right? That, we're taught that this is our back and there's muscles and joints and they can be damaged and that's what can create pain. And so often it's trying to change beliefs that might be, years old, go back in the family, etc., which can be very challenging.
Exactly, and this is exactly why I started this podcast, and I wanted to invite researchers to educate people on your posture doesn't cause back pain, and it's not, even people with strong core and strong bodies have chronic back pain. I'm bodybuilders, we all have, or some people think that obesity, yes, it can be a contributing factor, but it's not the cause. Back pain is a mix of, it's kind of like ingredients for a cake. We mix it, or a cocktail. We have different ingredients.
Yeah, yes, exactly. That's exactly the best way to think about it. There's so many different things that could be contributing to that pain, and that will be different. The different mixes will be different for each individual person as well. And yeah, so if you hear that this is the one thing that's causing your pain, and if we fix that, it will get better, that's usually not likely to be the case. And so I'd be a bit concerned if I heard someone trying to tell me or trying to tell another person that.
Then you should be on social media, all these people, your core, your weak core. And there is even a core program in the United States. He is huge. He has hundreds of thousands followers on YouTube, Instagram, and he is He is very famous here, and he believes that it's the weak core, that he fixes the weak core, and then you're gonna be better.
Yeah. And for some people that will work, but not for
Because
everybody.
of the beliefs, right?
Yeah.
Because you believe that the weak core, but it's not your
Well,
weak
I mean,
core. It
look, it can be a contributor. So if that's
it
your
can
main
be,
contributor, then strengthening that will be helpful.
but
And
not for
certainly doing
everyone.
that sort of exercise will be helpful. But yeah, it won't be the thing that cures their pain for everyone. And I think that's a dangerous place to land if you're looking for a cure for chronic back pain. That is tricky. We really need to change the mindset that it's more looking for strategies to help manage the pain so that
It,
if you do get it, you know what to do
it
about it.
And exactly right. I had chronic back pain, and time to time, I still have my back pain. So it's not like you are going to live pain free forever. Come and see me, I fix your back pain, and then you don't have to live with pain. That's not true. We have physical and also emotional pain, and that's part of life as well.
Yep, exactly.
Things come up more stressful. For example, I have a new client, and she admitted that now she knows, looking back, why she had back pain. Her mother is about to have a huge surgery. She was worried about her. She had to travel overseas. She was away from her family for 3 months, and bang, she ended up with back pain. And she's
Mm,
actually my friend. And she called me that, Bernadette, I need your help with my back pain. And we had a discussion, and she now knows that, oh yeah, absolutely, I was stressed about my mom, and being away from the family, from the kids, and all sort of thing. But now she knows what to do, and it's good.
that's excellent. Yeah. And it's very
Now,
empowering for a person when they
it,
can figure out what
and
it is that's
it,
triggering it,
and
what they
it
can
was
do about
her,
it.
and I didn't even brought it up. She was the one. I think it was the stress too, and I'm like, definitely, it added on.
Yep.
I'm not saying it was only that. Lack of sleep, she wasn't sleeping as well and as much because of, she was worrying about her mom. But so, going back to the research paper, you also found that exercise probably reduces disability long term. But a lot of people are actually scared to move. They think pain means damage. So
Yep.
how should they approach exercise when their back hurts?
Yeah. It's a really good point. And again, there are different sort of stages. So, if you've got really what we call acute pain, it's really severe, particularly if it's pain that, particularly hurts when you do a particular activity, that is a warning sign. So for a short period of time, we probably do want to avoid that particular thing that's really aggravating your pain. To keep pushing into it probably wouldn't be a smart thing to do at that particular time. But that won't last forever. That really acute pain will start to decrease. And even in those stages, we can often find movements you can do. So even just so, if I get someone in to see me who's got that really acute pain, we'll do strategies to try and reduce that, but we'll also try and find movements that don't hurt, that, sometimes can actually be relieving, or at least don't change anything. And I'll encourage them to keep moving in those particular, what we'd call sort of normal or safe movements at that particular time, and maybe just avoid that one other movement that's making it feel a bit worse at the moment. But then the next thing to do is to really try and sort of get back into those movements as your pain starts to decrease. And so it's important not to be fearful of those movements, or
Mm-hmm.
think that by doing that again, it's going to create the same problem that you've had previously. And that can be hard, particularly if you had very severe pain. And so we commonly see that with people who may have had, say, for instance, a disc injury, bending hurt, and so they stop bending. And, we often get very well-meaning advice, but actually in the long term, not very helpful advice to make you can't bend forward to pick something up. You've got to bend with your knees, etc. If you're going to pick up something really heavy, that's really good advice. If you're going to pick up a pencil off the floor, you shouldn't need to bend with your knees. You should be able to bend no problems. Okay, so we need to be reactivating those movements. Now, that doesn't mean that as soon as there's a decrease in pain, we go, okay, now to start bending. We might have to do that in a
Gradually.
progressive fashion. Yeah, make sure that they feel it's safe, and get them back into those movements in a safe and sort of supportive environment. But it is really important to reactivate those and get back into them. And then once you're back into those sort of normal movements, then adding exercise onto those is definitely safe and something that can be encouraged. Now, when we start any sort of exercise that we haven't done for a while, it's quite likely that you'll get some discomfort with that. That would be really common. You go to the gym, if you haven't been for ages, your muscles are going to be sore the next day because you haven't used them for a while. And so it's a bit of understanding that there will be some potential discomfort and working out what that level is that you're okay with, and that you can then keep exercising through, and what might be a bit of a sign of, actually, maybe I've probably done a little bit too much. I'll just back it off a little bit, but get back into it soon. So it can be a little bit of a, balance beam, just trying to figure out that right level. But yeah, it's important to get back into exercise.
What I usually do with my clients is, if the pain subsides within 24 hours, we are good. You will have some pain. But if it lasts more than 48, then we need to, back off with the intensity and the volume of the exercise, because it was too much. And we don't want to scare them. I rather do them and start light, and then baby steps gradually, so they feel safe and confident in their bodies, because that's really important.
Yeah. And that would depend on the person as well. And so you can tell them, the people who are quite fearful of exercise, absolutely, those little steps are really important to give them confidence, etc. Then you get the opposite extremes of people who just want to throw themselves back into absolutely everything. And sometimes we even have to go, okay, let's just back off a little bit.
Yes.
Come to this sort of level here before we get straight back into it. So yeah, the advice will be a bit different for different people as well.
So your results said the improvements were often small but meaningful. How should we think about that? Because when you're in pain every day, a small improvement might sound disappointing.
Yeah. So there's a couple of things around this. So a lot of this is what I would call researcher speak. That we have to present our results as to what we can say the evidence definitely shows. Okay. So one thing to note is that what we're talking about here when we say that there's a small effect is the mean effect. So that means that's the average effect. For everybody who was in the trial, the average effect was, so if it's a small effect, it would be around between 5 to 10 points reduction in pain or disability on a 100-point scale. Which doesn't sound like very much. That's what the average person got. Of course, there were people who were doing better than that. There are also people who were doing less well than that. And then that's the average. So that's what we can report as researchers as being what we think is the best estimate of the effect of that particular intervention. How much that particular effect, that 5 to 10 points on this 100-point scale, means to an individual, though, is a very different thing. And that can vary on a lot of different factors. So, if you've got really high pain to start with, then a reduction of 5 to 10 points. So say you've got pain that's up at 80 points, a reduction of 5 to 10 points might not be that relevant, but then it might be enough to just be able to get you down to a point where you can get back into normal activities or back into some activity. So it can still have those beneficial effects. If you started with a pain level of, say, 20 points, then a difference of 5 to 10 points has just halved your pain potentially. And so it can be more effective. So it depends where your pain started. It depends what you do once you've started to reduce that pain. So if you just reduce the pain and do nothing else, it may not be that meaningful. But if you reduce the pain and then get back into your activities and get back doing things that you enjoy and like, then you'll get more follow-on effect from it. And so it can be a lot more meaningful. It also depends on what the treatment is that's helping to create that decrease in pain. So, something like surgery, we know that has, high costs, and it also has a number of risks associated with it. So if you're only going to get a small reduction of 5 to 10 points, that may well not be worth all the cost and risk that you'd have to do to do that surgery. But if you do something like exercise, which we know has very low to no risks really, and can often be free or very low cost, then it's sort of like, well, you may as well try it and potentially get this, even if it's a small benefit, some benefit, because there aren't many risks involved with actually doing it. So yeah, lots of things to think about.
It's true what you said about surgery. I have many clients who had spinal fusion and they ended up with me because it didn't work. However, for some reason, many people go and try that first because they desperately want to be fixed by someone else and they don't want to put in the hard work. To be honest with you, that's what happens. I mean, I'm in the States and we have tons of spinal fusions, a lot. Even when they shouldn't, they just have it. And they think, oh, maybe it works, maybe it doesn't, but at least I tried. And then the worst part is they lose so much flexibility. They can barely put their shoes on because their spine is not as flexible. And some of the exercises are not achievable anymore because of that. And unfortunately, that's my experience many, many times. People have spinal fusion and then they wanted to avoid physical activity, but then they end up doing physical activity and they could avoid I don't know how much does spinal fusion cost, but the lumbar fusion. And they still end up with physical activity because that's what evidence says. And nobody educated them on maybe you should try physical activity for more than a month or two.
Yeah. Look, it's something that's really common here in Australia as well, spinal surgeries. And, it's often seen as either as a last resort. So I've tried absolutely everything else.
And I'm not saying
And
all doctors do that. I had some
no,
amazing
no,
doctors
absolutely.
and they say physical activity, physical therapy first, and they try not to do it.
Yeah. Yeah. And yeah, I'd say that's getting more and more common as, medical doctors are also being educated as to what the evidence base is now saying, etc. But yeah, so we either see it as people see it as a last resort. They've tried absolutely everything, and that's all they've got left. Or, as you say, it's seen as something that will get them better quicker and will help to fix that. And that again often goes with that underlying structural belief. Now, unfortunately, the use of imaging doesn't help in that situation. So particularly if someone's got quite strong pain, it's still very common in Australia, and I know the evidence that we've seen in America as well, that if you go to a practitioner, you'll likely get some form of imaging. And imaging will often show a lot of changes on there, so things that are changes to the structure, to the bones, the discs, etc. But what we don't know is whether those changes are actually related to the pain you're experiencing right now or not. And in a lot of cases, they're probably not. We can usually identify the cases that probably are related to the changes by the type of symptoms you have. But if you're getting imaging, even if you don't have those sorts of symptoms and it shows these changes, they can be very worrying for people because it is a change to structure, and then they become concerned that that structural change is the cause of their pain. And then surgery makes sense because it's going to actually help correct that structural problem, is what they see.
Like disc herniation and disc degeneration, there is evidence that as we age, we have more.
Yep,
I mean,
absolutely.
it's not the
It's a normal
cause.
part. It's a normal part of living. Yeah.
Exactly. It's like wrinkles. I had disc degeneration. I had MRI, of course, when I had chronic back pain. And I had disc bulges and disc degeneration in my early 20s. And it could be genetics
Yeah,
as
lots
well.
of things that can be things. But I mean, basically, our discs are made to bulge. So as you put weight down through them, they will bulge out a little bit, not enough to be noticeable, but over time that bulge can become more apparent, and then it can show up on our imaging.
Yeah.
As we get older, we know that the discs do start to like lose some of their moisture, the same as most of our other tissues do, and that's called degeneration. And these are all quite normal changes. Now, for some people, they can be related to symptoms. But for a lot of people, they're not. And our challenge is determining which ones are which, and therefore what the most appropriate treatment for them are, which can be tricky. As I said, sometimes the clinical symptoms can be helpful. So, for instance, a condition you can get if there's a bit of degeneration around the spine is what's called spinal stenosis, where some of those degenerative changes actually narrow the canals where the spinal cord or the nerves go through, and that can put pressure on the nerves, and that can then create symptoms. But and it's one of the most common reasons for recommendation for spinal fusion. But those symptoms are quite specific, and so if you're not getting those symptoms, then it's unlikely those changes are actually creating a problem for you at that point in time. And sometimes that's not what's always put together properly, because unfortunately, once you see those changes on an image, it's hard evidence. There's something going on there. There's something that's changed in my structure, and that's the cause of my pain. And that becomes very hard to change that belief at that point.
Dr. Jenkins, so many people listening right now have been in pain for years, and they've done the physio, they did the scans, they did the chiropractor, and they are exhausted. What would you say to someone who feels like nothing will ever work for them?
It's such a difficult situation to be in when you've tried so many different things and it doesn't seem to have impacted your pain, or you might have got little changes, but then the pain's come back again. And I think the really important messages are that strong pain is not a lifetime condition. It's not something that you have to live with for the rest of your life. We just need to try and identify what's really contributing to your pain and what's really driving your particular pain. And while you might have tried lots of different things, they just might not have identified what those key drivers are. And so it does often involve then really having a think about, when does the pain get worse? When's it triggered? When do I get less pain? Because it's very unusual for people to have constant severe pain 24/7. There will be fluctuations in it. So when does it get better? When does it get worse? What sort of things do I think might be affecting it? And often the person themselves is the best person at identifying those. They just need that sort of time to think about it and understand that that pain that they're feeling does not mean that there is damage inside their body. Okay, because it's that belief that there's damage, I can understand why they go, it's not going to get better. That's damaged. And I've had many patients say that to me, often when they've seen a scan, unfortunately. Yeah. And they're like, I had one in particular who came in with what I would call a very sort of normal acute back situation, which was probably mostly related to their muscles spasming in their back. They happened to have been to a GP and got some scans, and they showed some disc bulges, which again, very what I would call normal type disc bulges for their age. And they didn't have any symptoms that they would be related to what they had at that time. But literally the first thing he came in when he saw me was like, look, I know you can't do anything about the disc bulges. I know I'm going to have ongoing pain from that, but is there anything we can do just to reduce it a bit? And so it's a matter of trying to say, no, look, the pain you've got right now is not an indicator that there's damage that's causing it, and that there's a lot we can do and a lot you can do to help to try and decrease your pain. I mean, one thing I do find that's quite helpful is just remind them that a week ago, 2 weeks ago, etc., you didn't have any pain, okay? But those disc bulges would still have been there, okay? They didn't happen overnight. So sometimes that can be helpful. In people who have had that very long history of pain, though, of course, that's not a helpful situation because they've had the pain for a long time. So it's really about trying to help them understand that there isn't permanent damage in their back, that their back is actually strong and resilient. We've got lots of really good, strong muscles around their back, and it's something they can have confidence in. And we need to identify what other contributors are affecting the amount of pain that they're feeling and how we can best manage that.
Thank you. You mentioned in the paper that many studies had a high risk of bias. I think about how many ads, reels, and TikToks promise miracle fixes. How can people separate what's actually evidence-based from what's just marketing?
Yeah. And in the world of social media, that is incredibly difficult. I mean, one of the first things you can do as a person at home, if you don't have a research background, is to find a clinician or a practitioner that you trust and to ask them. And you want someone who will reflect on what the evidence actually says and help you to interpret that, because it can be very difficult to interpret. So high risk of bias is something that we look at when we assess trials to see if the way they perform the trial means that there's the chance that there could be some bias in the results. So the results may not be as accurate as we would like them to be because of the way the trial was performed. Now, that doesn't necessarily mean that the trial was done badly or that there was bias. There's just the potential there for it. If we've got lots of trials, though, even if they are at high risk of bias, but we're seeing really consistent results from them, we can still be pretty confident in those results, even if the individual trials potentially had bias. If we see lots of really good consistent results, then they're probably all telling us the same thing. And so we can be quite happy with that. That's what we see in things like exercise. It's actually really difficult to do an exercise trial that's low risk of bias, because one of the things that we need to be able to do is to be able to give a treatment where the practitioner and the patient won't know what treatment they're getting. Are they getting the real treatment, the exercise, or are they getting a placebo treatment or a fake treatment that shouldn't do anything? Now, for exercise, if you're getting exercise, you know you're getting exercise. So it's very hard to do a low risk of bias trial for exercise. So, but what we see is lots of really consistent results. So we're still very confident in that finding. For these miracle type cures that we see online, social media, often there's no trials that have been done on them at all. And so that's one particular thing. And then if there are, what we often see is that we see some really outlier results. So we'll see this one really good trial that potentially has high risk of bias and has these amazing results. And then we'll see other trials that have been done that have either very small or no results. And I'd be quite concerned about that discrepancy. So if we're not seeing consistent results, that'd be important. The other thing I always think, and it's probably a little bit of my natural cynic in me, but basically if it sounds too good to be true, it probably is. Because if it helped everybody, why aren't we all using it already? Why isn't that what's being recommended in the guidelines? It just doesn't make sense that one thing is going to help everybody, particularly with something like back pain, which, as we've said a lot today, is quite complex.
Yeah, true. You spent years reading the data, the stories, the patterns. When you step back from all of it, what does this research tell you about people and our ability to recover?
Yeah. So the important thing is that we're seeing changes, all right? We see changes both in these sorts of trials where we're actually testing a treatment, but also if we just do trials or studies where we look at people's progression over time, we see that a lot of people have pain that gets better. That's the vast majority of people. Their pain does get better. And we see lots of people that have what we call fluctuating pain, where we have episodes where it gets worse and then it gets better and then it gets worse. And that's the most common type of particularly chronic back pain. And so that tells us that the body is really good at managing and helping us and being resilient and coping through different strategies, because things do always then decrease again. And so, yeah, I think the important thing is that there are definitely ways to help people. Our body is strong and resilient, and even just by itself over time, it will help itself. The important thing is just trying to match up the right treatments with the right people and find the things that really help each individual.
Thank you. Can you, to the listeners, can you give them 3 tips? 3 tips if they've been suffering with chronic low back pain for years. Give them 3 tips, what they can do.
Mm-hmm. Yeah. So yeah, particularly if you had long-term back pain, I think one of the first is just to find a practitioner who you can trust and who will help you to try and identify what might be contributing to your pain. Now, the type of practitioner is not the most important thing. So you could be a general practitioner, physiotherapist, a chiropractor, osteopath. There's lots of different people out there. Could be someone like yourself doing Pilates, etc. That's just someone who knows. The important thing is that they will look across lots of contributors and not be focused on one particular thing. And so someone that will discuss your care with you and really be talking to you about what sort of triggers do you notice? What do you think might be involved in this? And then thinking through strategies to help manage that. And so, I mean, there are, as we've already mentioned a couple, there are some different programs that can be helpful with that as well. So one that's becoming more well known recently because of the large trial that's being published is cognitive functional therapy. Just people that technique is designed to identify the contributors. So if you know someone's performing that technique, that's what they will be doing. But there are lots of other practitioners who will be doing the same thing. It just isn't called that. So it's maybe a little bit harder to identify, unfortunately. But yeah, just finding someone that you really trust to help you through that, I think is really important. And then just trying to get back into your everyday activities. And even if it seems like a really, really small step, just starting with something. Okay, so having a think through about what it is that you miss doing, what it is that from, because of pain that you really miss or you want to get back to, and how is it going to be possible to try and, even in a little way, get back towards that. And even if it's just something as simple as just going for a really short walk and just doing, an extra 100-meter walk than you normally would do, and then, making it a little bit longer the next day and see how you go. Just those little steps can really be helpful to get you back towards getting back into those activities. And then lastly, I think just if you do really think that your back pain is due to sort of a structural underlying cause, just doing a little bit of thinking around that and just knowing that the pain that you're feeling is not related to damage in your back, and that it's still, your back is strong and that you can still get back into normal activities. And again, you might need someone to help you with that belief and to explore what that means to you, because it is challenging to overcome that by yourself.
Thank you, Dr. Jenkins. And thank you so much for being here and accepting my invitation to the show. I really appreciate you.
Not a problem at all. It's been a lovely conversation.
Thank you. And thank you, folks. This was all for this episode. We hope and see you next time.